before I talk about our experience with Alexa at Cigna, I thought I would share with you some background to help you put voice and what we have done in the broader picture of digitization. I will talk a little bit about digital disruption. I have been in this space for 2 decades now, starting at Bayer Healthcare, then at Citibank, TI Financial Services, and now at Cigna. And we've seen a lot of digital disruption. I'd like to share with you, some of that. Why voice is an emerging disruptor, and as Bradley mentioned, voice is going to be with us, for the near future. And then answers by Cigna, our first voice application on Alexa. I'd like also to share with you my views on a framework for voice innovation and integration, because voice doesn't stand alone. It's not a standalone application. It has to be part of your integral digital roadmap and digital transformation. And I'll summarize what I present in some takeaways. And I'd like to leave a few minutes for questions and answers. Summarizing the past 2 decades, I think we've been through much disruption for 2 decades now. And if I were to guess, each one of you in this audience probably can relate and is probably emotionally connected to one or two or many of these disruptors. On the far left is, I call them past disruptors, but what's interesting is that they stay with us. And now with voice, they're voice activated. So think of something as simple as the GPS. When we bought a car several years ago, we were willing to pay $600, $800, $1,000 for a GPS. Now it's free. You have Google Maps, you have Waze, and most recently, they're integrated with voice. So these past disruptors are current, and they will emerge, and voice will enable. You could go to Google, and I go to Google Maps and say, take me home, and the address is there, and it takes me home. Smartphones, several billions of smartphones worldwide. We call them past disruptors, but they're current, and they're emerging disruptors. Your smartphone is part of your anatomy. You do your banking, you do your healthcare, your entertainment, your travel, everything, and now the phone is voice activated. Social media, needless to say, social engagement, and wearables and neurables and hearables, they are here, and they are an integral part of our healthcare ecosystem for remote monitoring, for engagement, for health and wellness and fitness, and many companies, not just healthcare companies, technology companies are investing in these. And then part of the current disruptors is, I list here the mobile network. 5G is upon us. And once we have 5G, we can stream video. It's the persistent internet. It's the always on. And voice is going to be so significantly enabled with a fast network like the 5G network, and video and so on. Advanced analytics and big data for highly personalized experiences. To understand your customers, you need to have data about your customers, and you need to personalize the experience. You can't speak with a megaphone to everyone with the same message. And collecting data about your customers and their journey with you and their interactions and their likes and dislikes and behaviors allows you to be very highly personalized. And cloud computing. The cloud is going to be a huge enabler for disruption, digital disruption, and for voice. I was a couple weeks ago at a technology symposium in the Silicon Valley, and we had a tour of Google. And it is nothing short of stunning, the extent of investment that Google is putting in the cloud, in a secure cloud for cybersecurity, because once we're talking about all of this, hacking and cybersecurity, and Google, we had a tour of their cloud campus, and it's amazing. I mean, from laying on the beds of the ocean, the cables to transmit information and data in a highly secure way, to buying server farms and so on. So these technology companies like Google are very highly invested in all of this. That's really going to be integral part to what we do. And as I mentioned, these disruptors, think of voice. They've just started in their early stages without voice, and now voice is becoming embedded in everything we do. We talk about the Internet of Things, the healthcare Internet of Things, devices talking to devices, human talking to devices, devices talking to humans. And think about the applicability in healthcare. And one example I mentioned here, this is the pill pack. If anyone is familiar with the pill pack, it's for compliance. It's a 7-day pockets of medicine for those who need to take high medication. And when you open it, it sends signals. It's for compliance if you have teenagers who need to take medication, or seniors or elderly. And now, PillPack, companies like PillPack are investing in voice so that you don't even have to open. You just say, open Monday or open Tuesday, and you could do it. And Amazon most recently, talking of the giants and their involvement in healthcare, purchased PillPack. So we're going to see a lot of partnerships and acquisitions and innovation along those lines. Machine learning and artificial intelligence, for me, I can't speak about voice without putting it in the framework of artificial intelligence and machine learning, which is going to be the next big frontier, not only for healthcare, for our life in general, banking, financial services, entertainment, everything. And blockchain, you hear a lot about that, cryptocurrency, blockchain. How does it apply in healthcare? For instance, for our business, physician information, core to our business is to have current information about our doctors. Who are our doctors who are in our network? And it's a big challenge, really, to keep current information about the doctors. So blockchain allows you to start with information about the doctor, and once they move, change practice, relocate their information, you have this information created as part of records of a blockchain application. And drones, and one might think, what does drones have to do with healthcare? But there's a lot of applicability. You could have drones deliver medication for a disaster-struck area to ensure that patients are current and compliant with their medication in these disaster-struck areas where you can't go. I saw an application of a drone with an ambulance, in let's say, New York City or even Boston, in a highly congested area. If there are accidents, the ambulance can't go. Drone-like applications, for first aid applications and so on. And then augmented reality and virtual reality, how that is voice activated to augment our reality in what we do, and robotics for precision and surgery and so on. So when you talk about voice, think about our world, the immersive digital world we live in that touches every aspect of our life in terms of banking, healthcare, entertainment, and so on. So before getting into the answers by Cigna and Alexa, I felt like to frame this conversation. So voice as an emerging disruptor, I think there's a lot of data about the state of the conversational market and the uptick of voice and voice-enabled assistants. And people say at some point there's going to be a tipping point where people are talking to bots and machines more than they're talking to humans. And sometimes when you're in a public area, you feel like it's a reality now. So the numbers are stunning, and these are US numbers, but this applies globally, actually. In Asia, it's amazing if you go to Asia, the uptick on that. We have technology giants. We can name 7 or 8 of those globally, not just in the US, that are doubling down on investments in platforms, devices, content, and they're forming healthcare partnerships. I talk about PillPack, for compliance, and Amazon just purchased it. But you're gonna see significant investments by technology giants who have interests in healthcare, and we cannot not pay attention to that. And our partnership with Amazon is one of these. The cost of communication is near zero. So globally, these are global applications, in Asia and here in the US. And this is our world. In a world where everything is centered around an app. There is an app for everything, and now apps are voice activated. So where do you start? How do you position voice strategically? What makes sense for a world, for an immersive world like this to do? So why is voice an emerging disruptor? And Bradley mentioned a little bit about that, is that it's simple, it's easy. It's natural. Everyone has a voice. It's frictionless. It's a frictionless way to engage. But to summarize my few past slides, it can't live in the vacuum. You can't just build one application and expect to disrupt your business or significantly engage your customers. It has to be thought of from within the framework of artificial intelligence, biometric and behavioral identity. So for authentication and for cyber hacking and so on, many companies are using voice for authentication together with your fingerprint, your facial recognition, your behavioral identity, how fast you type on the keyboard, how slow or hard or tight you push the keyboard. So voice is not just for applications, it's part of a biometric and behavioral identity that companies are using now for authentication. It's part of device integration. We talked about the Internet of Things and the healthcare Internet of Things and how you can activate with voice that as well. Think about it also as part of the augmented reality and avatars that are now, healthcare companies are using them. One application for augmented reality is to deal with depression, to deal with stress, to deal with pain management, and so on. Many companies have that. And last but not least, as I've mentioned, you need to think of it from machine learning, cognitive computing, data analytics. So don't think of voice as one thing you do, it's once and done. It has to be part of your overall strategic plan and bigger picture and digital ecosystem and how you work together, with all of that. So for healthcare, for instance, the future, the voice-activated future, and how we think about it at Cigna is urgent care at your fingertips. You could talk to your device and say, you're at a playground, your child falls, they cut their head. You could activate your voice. Through voice activation on your iPhone, you could ask, Alexa or any device, where is the nearest urgent care facility? And you'll get all the details. Is it open? How far it is? Is it in network? Is it out of network? Where is the closest CVS? How long is it going to take me to get there on my bike? And will they be open when I arrive there? Navigate me there. I mean, these are not fairy tales. These are things that some companies are working on now, and including us. You could use voice to check on the symptoms of a disease, medications, potential side effects. What's my HSA balance? What were the 5 last HSA transactions that I have had? And connect me to customer service. Alexa, connect me to Cigna's customer service, renew my prescriptions, send my MRI to my neurologist. I mean, these are all things that companies like us are thinking about. So, Alexa, all of that to get you to Alexa Answers by Cigna. We've had a partnership with Amazon. We've launched Answers by Cigna last March. And overnight, it became a global sensation. I'm biased, but it's really, we were shocked on the uptick of the media about what we have launched. And we were very surprised. We're pleasantly surprised. So you could go to Alexa now, to Answers by Cigna and ask, what's an HSA? And really, the goal was very simple: demystify healthcare. You will be surprised how many people don't understand the basic terms used in healthcare. And our business is very complicated. And one of our goals was to bring simplicity to complexity. Use something natural like voice to demystify some terms. So we started with 150 terms. We've evolved it now between March and now to over 250 terms explained. And over time, we built some intelligence. If you ask what's an HSA, you will say, Alexa would give you the answer. Would you like to know what's an HRA or something else? So very simple. And how we chose what we included is we used our data. We're like, what do we start with? There is so much content. What do we start with? And then we said, what are our customers calling us for? What do they call the call center for? What do they go on the web and search for? And let's stay there. So we're very committed to evolving this, and especially after how much success we have seen with it. Telling the Alexa story, the Answers by Cigna story with numbers, we have actually, these are a little outdated. We have close to 4,000 customers now who have engaged Alexa, and 11 reviews with 5-star ratings, which is not bad. So this was our pilot. This was our experimental, what is it going to take to put a voice application out in the market? What are our future aspirations is to get more personalized experiences. So when I talk to Alexa, and our example is with Alexa, but Google has Home. There are devices and platforms and so on. But our aspiration is to have recognition, voice recognition. When you talk to Alexa, to know who you are, to know who's your health insurance, are the doctors in network or not, have you reached your maximum out of pocket, et cetera. And of course, there is HIPAA requirements that, so we're working really with companies and with technologies. And I know Nate from Orbita is here somewhere, maybe. Yeah, hi. So we're partners with Orbita, and Orbita, I think Nate is gonna talk later, in that you create content once, and they have a chassis where you distributed so many devices. And that's really the goal. You don't want to create and customize content to every device and so on. You want to create it once and beam it, use a chassis like Orbita to beam it in many platforms and devices. So voice needs to be integrated in part of your, within your digital ecosystem for voice recognition. Geosensing, the example that I gave you, you're at a playground, your child falls, they cut their head, you want to ask where is the nearest urgent care. You're geolocated where you are, and the way Alexa is going to tell you what's the nearest urgent care is if they know exactly, pinpoint where you are, and connectivity, and we will evolve it possibly to live video and chat and so on. So I think we all agree that our customers are well on their way to digital self-sufficiency, in that even before they go to the doctors, that's a long time ago. I was at Bayer between 2000 and 2005 when we did digital, when we launched digital, and even then we started feeling that customers want to be independent of the physicians. They want to do their research, they go on the web, there's so much digital information there that when they reach to the doctor, they want to be well informed. And I've showed you the slide of the total immersion that we live in digital. So they're on their way to digital self-sufficiency, even in medicine and healthcare. And that has started a long time ago. So how can a voice-first world educate and empower them? Because you want to educate your customers, you want to empower them. That's how you gain their trust, and that's how they come back to you. How do you gain their trust? Very important in healthcare. Trust is very important, and you need to be a trusted partner. Your company needs to be a trusted partner. Win their mind, share, and earn their business at the end of the day. So you see that I listed earn their business last, because you can't go into anything thinking, how can I get business? You want to educate and empower, gain the trust, win the mind share, and then gain their business. Where do you start in this digital first, mobile first, voice first world? So Brad talked about voice first. The kids born today are voice first. But I've been in this space 2 decades, and then we've started saying first, we're in a digital first world. Now this is the digital generation. Kids born, in these years and within this are born with digital. And now mobile came, and everyone it's part of your anatomy, your iPhone. Everything you do is on your phone, and now voice first world. So where do companies start? How did we think about voice? Where is the best place to start? This is the framework. I promised you a framework of, to help you think about voice. I would say content is first and foremost, and you need to treat it as a strategic asset. And Jeff Schwartz, Dr. Schwartz is somewhere here. Hi, Jeff. Yeah. Part of Health Navigator, we had a good conversation last week about content, because you could spend significant amount of money building your digital, ecosystem. If you don't have content, and if you don't treat it as a strategic asset, you really will not get there. And what do I mean by that? So companies have massive amounts of content. You have white papers, we have thought leadership, and these tend to be big PDF files. And when the web came about, we started putting these PDF files on the web, and very quickly we realized it doesn't work. We need to decompose these white papers and these PDFs and put web-friendly content, and we did that. And then the mobile came, and we started putting the web content on the mobile, and we realized it doesn't work. We need more mobile-friendly content. And then social media came, and then the 144 characters came. And then we realized that content has a life cycle. You start maybe with a white paper or a PDF file, but for every medium, you want to make it medium friendly. And then if you want to put it on YouTube, it has to be video friendly as well. And now voice for Alexa, we started experimenting with it, and we felt we can't just give it too long of answers. What's an HSA? What is the quickest, the shortest answer you could give Alexa to answer to keep the interest going? So I will encourage you to treat content as a strategic asset when it comes to voice. Don't start creating content for voice. Look within your organization, use data about your customers, and then start there. And that's how we started Alexa. What are our customers calling for? What are the most misunderstood terms? And what do they come to our websites and mobile applications to search for? And we said, these are the 150 terms we're going to start with. And we're going to create the content that's friendly for voice. Nothing lengthy, exactly how we took the PDF files and the white papers and webified them for web-friendly, and then on the mobile, and then the 144 characters, and then YouTube, and now it's voice. So I emphasize content. Partnerships. You can't go it alone. And I mentioned Jeff Swartz and Health Navigator. And I remember when I was at Bayer Healthcare, between 2000 and 2005, we got significant amount of money to build our digital. Bayer was very much into digital. And then we realized we need content. And then we're not in the content business. We're a healthcare. We're a pharmaceutical company. And we found a niche company in New York that has 12 doctors, 12 MDs, and all they do is content. And our drugs were cardiovascular, anti-infectives, et cetera. So we took over this company, and we said, we want you for the next 12 or 18 months to generate content for us. Because literally, we figured out that we spent so much money on our websites and then eventually on the mobile and social media, and we weren't equipped internally for content. So I encourage partnerships, and Jeff is going to be here, so you can have a conversation with him. But I focused in partnership on content, but I talked about Nate and our partnership with Orbita as well. But you see that I mentioned the 7 technology giants or 8 technology giants, and they're all working on partnerships. You've heard about Amazon, Berkshire Hathaway, JP Morgan Chase partnership. We've heard how Amazon acquired PillPack, because no one can go it alone, and you cannot go it alone. Don't want to do everything alone, because you will get nowhere. I think partnerships are key. Metrics and measurements. Tell your story with numbers. Become a storyteller and tell your story with numbers, because that's how you're going to win the hearts and minds and pockets and purses of the people who are going to be funding this. No one has an infinite amount of money. And once you start talking about voice, people are going to think you're strange. Like, how does this fit with healthcare? But once you have a pilot, a small cost pilot, and you have the data to prove your points, people would want to invest in. And when I think about the last 20 years and the things we've done in technology, even with search engine marketing and search engine optimization and all these social media applications, it all started with a small pilot grounded with metrics and analytics. And metrics and analytics capture data about your customers, about their likes and dislikes. Your customers tell you every day what they like about you and what they don't, and use this data to build your applications and measure the effect. So measurements and metrics are key. And technology platform interoperability. Nothing lives in the vacuum, especially like Cigna is a 225-year-old company. It's a $50 billion company. It's a global company. So you can imagine our technology platforms. And you need to focus on interoperability, because if you don't focus on these, at least that's my opinion, and you could think of few more, you could, you could have something that's fun, something that's cute about voice, but is not an enterprise-wide integrated application within your ecosystem. So content, we've talked about that. You want to manage the content life cycle. You want to put different content at different stages of your customer journey. And of course, I'm assuming that before you do anything, you want to journey map your customer's journey. How do they come to you? Different kinds of the journey for different needs. First, they're going to be educated about you, et cetera. And then put robust content during self-discovery about your company or product, and make your digital system a destination, and learn, iterate, revisit, and improve. So content is key. It's a strategic asset. Partnerships, internal and external. And I emphasize internal partnerships because voice is not the one department's application. You want to partner with product management. If your product people are building a product and you want to voice activate it, you want to partner with product, you want to partner with your business people, with marketing, and of course with IT. So you want to communicate what you're planning to do, you want to collaborate, and you want to align. And I think doing all of this internally is key. And you might want to run a quick pilot, without all of this, dotting the I's and crossing the T's. But to get anywhere at scale, you need to be able to do that. Metrics, let metrics guide your decisions and interactions. We've talked about that. You need to measure. You need to become fluent with the data, understand what your customers like, dislike, what do they come for you to do, and build upon that. And you want to create an analytics culture within your organization, and you want to become a storyteller and tell your story with numbers. The fourth framework we talked about is technology interoperability, because you just can't build a voice application and hang it out there in the ether and not be part of your technology platform. So in my view, and I'm sure each one of you have their own opinions, I think the cloud is going to be revolutionary, and I mentioned, well, we've been working with the cloud for a long time, but I've mentioned our visit, the technology symposium I was at, and the visit with Google, and it is actually stunning what Google is trying to do. Connect the oceans, on the beds of the oceans, build server farms, and they talked a lot about security and authentication and all of that, because for any of this to be happen, there has to be trust that our platform is secure. The cloud data and analytics, we talked about that. The data about your customers, the data about your applications, and the analytics platform. Be obsessed with cybersecurity, because at the early signs of a breach, you're done, right? Every day there is a story about companies being breached. Sometimes there isn't much you can do about it. Stuff happens. But you need to be really obsessed with cybersecurity as you start to build and engage and become more robust. And the last one, you need to become agile. This is not a waterfall environment where you could do things sequentially and you have 18 months to prove. 18 months is the lifetime of a new technology. So if I reflect back on the last 20 years of me being in this digital space, every 18 months there is something new. You need to be nimble, you need to be quick, you need to fail and fail fast, you need to scale up, you run the pilots. At the early signs they're not working, you pull the plug. At the early signs you're working, you start showing the data to those people who have the money in your company, to your stakeholders, and scale up. So agility is key in this environment. And it's not something you can take your time. You need to hire people who have the agile mentality and who are innovative, and so on. So finally, for the takeaways, and like I said, I'd like to leave some room for questions and answers. Start with the pilot. Don't start huge and then get stuck. Learn, calibrate, revisit, and repeat. And learn is important because you're going to learn. Every organization is different. So Cigna is huge and an old company, 225 years old, but you learn about what is it going to take to get an application like this to launch in your organization. Who are your partners? Are you agile enough in your company to do this? Do you have what it takes? Do you have the internal partnerships? So I think the pilot tells you a lot about yourself as an organization. Are you prepared for this digital age? Avoid voice in isolation. We talked about that. So voice is a building block, and it's integral to your end-to-end digital journey, your digital ecosystem, your digital roadmap. It's not like I have voice, therefore I'm all set. You really need to think about it and build the partnerships around the organization around that. Plan for integration and scalability. Again, we talked about it doesn't sit in the ether, a voice application. For you to have a robust, meaningful something, it needs to be integrated. And it needs to be scaled because you're going to start with a pilot and scale at the early signs of success. Don't do it alone. Seek partners internally and externally. We talked about that. And you need to measure everything you do. The analytics, the numbers are very important. And this is, I think, one of the most important things, at least in my mind. Be customer-centric. Understand your customer like no other. Be obsessed about your customer. Know them more than anyone in your competition. And deliver to what your customers need from you. Not because it's a cool thing, but because it adds value to your customer. When you are about to invest so much time and energy and talent, and you're going to put your soul into what you're going to build, let alone your reputation within the organization, your credibility, you really want to be customer-centric. And you want to say, our customers want this. They told us this based on the analytics and the data, and that's why we're building it. And you want to be, when the next big idea in the organization comes, or when you come with the next big idea, and you want to socialize it within the organization, once you've done this, you've built credibility, you've built your brand, people trust you in that you know what you're doing. So I think these takeaways could help you. And with that, I want to leave some time for questions and answers. This is my contact information. I talked to Terry is somewhere here last week. Yeah, Terry is having a blog, and he's going to be talking later. He asked me, what's the best way if people want to connect with you? And I told him, like you did on LinkedIn, because I think we had the blog and the podcast, from the podcast, and people listened to that, and I got a lot of calls and contacts on LinkedIn, and I've talked to many of you prior to the conference through LinkedIn. So I think LinkedIn is very powerful. Trendblazer is my handle, and this is my personal email if you need to connect with me. I'll be here all day. I'll be here at 5 p.m. Reception, but we have time, a few minutes.
There's two microphones here. There's one on both sides. Joe, I mind using those throughout the day. We're going to be recording this so we can make some of the content available on YouTube. Brett, go on ahead.
Thank you so much for the presentation. I have a couple quick questions for you. One is, when you decided to move forward with the project to do Answers by Cigna, how long did it take you from idea until you launched this past March?
Actually, at Cigna, we have many ideas. You'll be surprised, for a company like Cigna, the level of innovation and creativity that goes on. So we toss ideas around all the time, and there are some big ideas, right, coming around. So we started talking about voice, and then we got serious in September. And then, of course, we needed to line up the partners. We knew that internally we have a lot to do internally. So, we needed the help of partners. So it took us, I want to say, 3 good months to do that.
Right, to get set up, and then until launch, maybe 6 or 7 months?
The total process,
yes.
From the first idea, this might be a good way, voice has arrived, we want to leverage it. I want to say, from the concept until we launched in March, about 6 months.
And when you were developing it, you said you partnered with Orbita. Mm-hmm. Did they help you actually launch the skill, or did you develop in-house, or did you use another third party?
No, actually, we built, before Orbita, we built this tool, Answers by Cigna, and then we want to go on other devices. We want to go on Google Home and Microsoft and so on. Right. And then we started talking to Orbita because we felt that we need to go through the same process again, for every device and every platform. And Orbita has the chassis such that the content we've created for Alexa, they could help us repurpose it. So that's where Orbita came into.
So last question is, when you decided that you were going to just answer questions and you're going to put content first, topics first, and not Cigna first,
yes.
Did you receive any resistance organizationally where your colleagues were saying, well, why aren't we talking about Cigna first? Why are we doing all this other work first?
Right, good question. We want to be customer-centric. So we brought the data, my team brought the data in that people call the call center with these questions. There is so much like basic information our customers don't know. And they come to the mobile to ask these questions. So we started, I mean, really the selling argument is this is what your customers want. You need to have the data and analytics to have the argument. You know, so many thousand times people call to ask, what's an HSA? Where am I? What's my balance? And so on. So I think that's how we decided.
Thank you.
You're welcome.
Hi, very interesting presentation, thank you.
Thank you.
Question I have is, are you going to primarily focus on administrative type of interactions, or is your goal to go into clinical applications as well? And if it is, how do you deal with Alexa not really being necessarily HIPAA compliant?
Right, good question. So, you know, I said pilot and prove the concept first to gain the hearts and minds and the purses, you know, of the people who are paying. So once we did that, and the media attention that took place about this, you know, what we have launched, internally, there was a lot of energy. So people started coming and saying, you know, in the seniors business, you know, the seniors, their dexterity is not very good, their mobility is not very good, so voice is perfect. Let's have a voice application for the seniors. So the ideas start coming internally. And when you have a culture of analytics, you want to say, when people come to you and say, could you help me build a seniors application or something, you're going to say, what is the data? What are the seniors not getting? You know, what do they call you the most for? So I think that's how we're going to evolve it. And there is already inertia and momentum within Cigna because of the success of what we have done. And actually, this approach in voice applies everywhere. I remember back in 2002, 2003, I was at Bayer, and we wanted to use search engine marketing keywords for people when they search to find us. And it was like a joke, you know, for a pharmaceutical company that sells drugs, you want to use keywords to do search engine marketing. But we ran a pilot and had the data, and then everyone, like the product vice presidents, came and said, I want this for my product, can you do this? So I think that's really the theme. And then when it comes to HIPAA, we have to evolve with the industry, with the technology. So many companies also, I think Orbita, I don't know what Nate is going to be talking about. I probably preempted his presentation. But HIPAA, the companies have to become HIPAA, the ones we're going to work with. And we're partnering with Amazon. And it's part of their plans is to become HIPAA compliant. So everyone knows in healthcare, you could go so long. But our goal really is to hyper-personalize the experience and make healthcare affordable. And to do that, we need to get more into the personalization aspects of it, and that's where HIPAA becomes. So the technology and you know, the technical platforms have to evolve with us. And I have a lot of confidence in the big technology companies that they're going to put the money and the effort for that.
Good morning. Thanks very much. I'm really appreciated your comments, and I take my hat off to you for being the first to plunge in as an insurer.
Thank you.
A few things. The first is I too saw that Amazon had hired someone to bring them into HIPAA compliance, so I know that at the corporate level that they're going to be working on that. I can think of many use cases for the consumer and patient in any health situation. And I know that they're going to be years away for many, many reasons, but I just wonder if they're on your strategic trajectory. The first is, one is communications and one is clinical. And the communications is, I want to send a message to my doctor. Yeah. Alexa can already do that. Insurance companies and providers already have secure portals and secure messaging. So it would be a fairly easy from a conceptual and a workflow leap to say, Alexa, text my doctor that I had X. And the second one that comes to mind, again, these are just some of many, is Alexa, what were my lab results last week? Yeah. So is that, are those kinds of things on your longer term, and about how long do you envision before you begin to roll those out?
Right, I think we're going to reach the tipping point of voice in 2019.
Pardon me?
In 2019, if you ask me. So the life cycle of a technology disruptor is 18 months. Once you start, like, I think within an 18-month time frame, we should be able to do everything that you have mentioned. And it's not too much ambitious to say that transactionally, everything your customers go to your website or your mobile to do, you should be able to do by voice, because it all boils down to bits and bytes and zeros and ones. And if you digitize it, you can stream it in any medium. So I think what you have mentioned, we have case studies, I didn't share them, but we have many case studies where we're saying transactionally, people come to our website to do this, or they go on the mobile to do this. We should be able to voice activate that. So I think I'm very optimistic about the future, and it's not the end of things, voice. We're gonna have a point, and actually conferences like this and applications like what we have done work as catalysts to rapidly get things to happen. But I think it's in the immediate future, in the near future, what you're talking about.
I only wanted to add that we know that patient portals are really underutilized, and it's because they're so poorly designed. They're not really user-centered design at all. So voice obviously offers a springboard for leaping over some of those intrinsic design processes.
Yeah.
But on the other hand, you've got to wait for the consumers and patients to be ready to use it. So thank you.
Right. You're welcome. I want to talk something about the human-centered design. I didn't mention it in my presentation because it's about voice. But for the consumer to use anything that you put in front of them, it has to be human-centered. The design it has to be built for humans. Because you look at many things and you say, what on earth? I mean, who's going to use this? Why would anyone build an experience like this? And I think the user research is very important. And iterate. So have a concept, build an experience, put it in front of the users, your target audience, and ask them to react to it. And then iterate based on the feedback and improve and put it. It's iteratively and incrementally. And the human-centered design is going to be key. Think about anything you put in front of the customers. They're humans, and it needs to be human for them to interact with it, whether it's voice, whether it's mobile, or social media, or video. And I think put enough emphasis. I didn't mention human-centered design, but it's key. I emphasized analytics because that's where you get the data. But human-centered design is key to getting adoption and ease and frictionless experiences and adoption. Yeah.
First of all, thank you so much for this enlightenment today, morning. Really appreciate it. I had a couple of questions for you. Number one, were there any talks about going Alexa versus Google, like Amazon versus Google? What were any conversations which made you go Amazon versus Google?
That's a good question, actually, because Amazon is like the devices are everywhere. My assistant told me they got 5 at home for the holidays, for the past holidays. And I told her, what do you do with 5? She said, my husband has one for his schedule. I have one like as an alarm and the weather in the bedroom. I have one in the kitchen for recipes. I have one in the living room. My daughter have one for music. I mean, the massive like adoption of the devices got us to think Amazon. But clearly, I mean, and when we think of voice, we shouldn't only think Amazon or Google or so on. Voice is embedded in everywhere. Your mobile have voice, and you could voice activate just about anything you want. So it doesn't have to be you have the device or so on. So voice is going to be embedded. I was actually in the cab. I took a lift to come here. On the radio, someone was saying their TV controller is voice activated. Like they talk to the TV controller. So voice is everywhere. Don't limit yourself thinking about an Alexa device or Google Home or something. The technology is going to be embedded, and it is already and will be more so.
Great, thank you for that.
You're welcome.
The other one I have for you is around adoption. What is your thinking around driving adoption, having repeat customers again and again?
Okay.
For
driving adoption and having repeat customers, go after value. Understand your customers and bring value to every touch point. If a touch point with your customer doesn't have value, be ruthless about eliminating it. You're adding friction, you're wasting your customers' time, they're gonna be upset about you. So I think for adoption, keep adding value, make it frictionless, take out the unnecessary, the things that irritate them, and your customers tell you, they tell us what irritates them, what they don't like about us. So go through your data, go through your analytics, eliminate that, and make it frictionless. And add value, it builds trust. In our industry, it's important.
Thank you very much. Excellent presentation.
I'm leaving it to Bradley or others to stop me if I'm over time.
Okay, I'm a very big believer in data analytics and
Yeah.
measure. I'm curious, in terms of the number of interactions Cigna has annually with their customers
Yeah.
and service providers, and what % do you think will be voice interactions over the next 3 to 5 years?
So Cigna has more than 120 million annual digital touch points with our customers. We've been tracking it, and it has been increasing between 20 to 25% year over year. So within our digital ecosystem, we have now over 120 million touch points. So imagine 120 million opportunities to delight our customers at every touch point. If we capture their data, what they hate about us, what they like, and improve what they like, take away what they hate, it's amazing. It's 120 million opportunities to delight. I shared with you that with the pilot we had over 4,000 now. But that was a pilot, that was simple. I think the way I think about it, like the evolution that I shared with you, first you had your white papers and your PDFs, and then the web, and then the mobile, and social media, and YouTube, and video, and now voice. We want to be present, omnipresent, at the medium of choice for our customers. So we don't want to force our customers to go to voice, or YouTube, or social, or mobile. Customers have preferences. Some people will always want to call the call center. They don't believe in any of this. So we have the call center. We want to be omnipresent, use data to understand our customers, where they want to be, and then be there for them at their channel of preference. Good?
Let's give Rowena a round of applause.
Thank you. Thank you so much. Thank you.
Give us 1 second, and Brett can tell